Inherited heart conditions are genetic disorders that affect the heart and are passed down from one or both parents. These conditions can range from relatively benign to life-threatening and often manifest in different ways. Here's an overview of some common inherited heart conditions. 1. Hypertrophic cardiomyopathy (HCM). Description: HCM is characterized by the thickening of the heart muscles, particularly the ventricles. This can lead to difficulties with blood flow and increase the risk of sudden cardiac death. Symptoms may include shortness of breath, chest pain, palpitations, dizziness, and fainting. Inheritance: often inherited in an autosomal dominant pattern, meaning one copy of the altered gene from either parent can cause the disorder. Management: treatment may involve medications, lifestyle changes, and, in severe cases, surgical interventions or implantable devices like defibrillators. 2. Dilated cardiomyopathy (DCM). Description: DCM involves the enlargement and weakening of the heart's chambers, leading to poor pumping function and heart failure. Symptoms include fatigue, shortness of breath, swelling of the legs, and irregular heartbeats. Inheritance: can be inherited in autosomal dominant, autosomal recessive, or X-linked patterns. Management: treatment may involve medications, lifestyle changes, and sometimes heart transplantation. 3. Arrhythmogenic right ventricular cardiomyopathy (ARVC). Description: ARVC affects the right ventricle, where heart muscle is replaced by fatty or fibrous tissue, leading to arrhythmias, irregular heartbeats. Symptoms: palpitations, dizziness, fainting, and sometimes sudden cardiac arrest. Inheritance: typically inherited in an autosomal dominant pattern. Management includes medications, lifestyle modifications, and possibly implantable cardioverter defibrillators (ICDs) to prevent sudden cardiac death. 4. Long quartz syndrome (LQTs). Description: LQTs is a condition where the heart takes longer than normal to recharge between beats, which can lead to sudden, dangerous arrhythmias. Symptoms may include fainting, palpitations, and in severe cases, sudden cardiac arrest. Inheritance: can be inherited in autosomal dominant or autosomal recessive patterns. Management: treatment often includes medications such as beta blockers, lifestyle changes, and in some cases, ICDs. 5. Brugada syndrome. Description: Brugada syndrome is a condition characterized by abnormal electrical activity in the heart that can lead to sudden cardiac arrest. Symptoms may include fainting, palpitations, or sudden cardiac arrest, often occurring during sleep or at rest. Inheritance: typically inherited in an autosomal dominant pattern. Management: treatment includes ICDs and avoiding triggers that can provoke arrhythmias. 6. Familial hypercholesterolemia (FH). Description: FH is a genetic condition that leads to high levels of cholesterol in the blood, increasing the risk of cardiovascular disease. Symptoms often asymptomatic but can lead to early onset coronary artery disease if untreated. Inheritance: inherited in an autosomal dominant pattern. Management includes cholesterol-lowering medications, lifestyle changes, and monitoring for cardiovascular complications. 7. Marfan syndrome. Description: Marfan syndrome is a connective tissue disorder that can affect the heart, particularly the aorta, leading to an increased risk of aortic aneurysms and dissections. Symptoms includes tall stature, long limbs, cardiovascular problems, and other systemic features. Inheritance: inherited in an autosomal dominant pattern. Management involves regular cardiovascular monitoring, medications to reduce stress on the aorta, and sometimes surgical interventions. 8. Ehlers-Danlos syndrome (EDS). Description: EDS is a group of connective tissue disorders that can affect the heart's structure and function, leading to complications such as aortic aneurysms or mitral valve prolapse. Symptoms includes joint hypermobility, skin that is easily bruised or elastic, and cardiovascular problems. Inheritance: Various types of EDS are inherited in autosomal dominant or autosomal recessive patterns. Management focuses on managing symptoms and preventing complications. 9. Tetralogy of Fallot (TOF) description. TOF is a congenital heart defect consisting of 4 heart abnormalities that occur together, leading to reduced blood flow to the lungs. Symptoms: cyanosis, bluish skin, difficulty breathing, and heart murmurs. Inheritance can be associated with genetic syndromes and may have a hereditary component. Management typically requires surgical correction in infancy or early childhood. Diagnosis and screening. Family history. If there is a known family history of heart conditions, screening and genetic testing may be recommended. Genetic testing, identifying specific genetic mutations associated with inherited heart conditions. Cardiac imaging, tests such as echocardiograms, MRI, or CT scans to assess heart structure and function. Electrocardiograms (ECG) to detect abnormal electrical activity in the heart. Conclusion: inherited heart conditions can significantly impact health and require careful management. Early diagnosis, regular monitoring, and personalized treatment plans are crucial for managing these conditions and reducing the risk of complications. If you have a family history of heart disease or experience symptoms, consult with a healthcare provider or a genetic counselor for evaluation and guidance.